get started. So this is our inaugural career week. So for those of you who were here last year, we did this full week of sessions, faculty coffee chats, mock interviews, alumni panels, a lot of good stuff. And so just feedback from students was just super positive. We did it virtual, of course, last year because we were, kind of living in our COVID world. But we also just found that it's just a lot more simple for both employers to join, for students. You can kind of fit in sessions here and there as your schedule permits with classes. So we just kept everything virtual this year. And so today is officially our kickoff. We've got 2 sessions today, and you've probably seen, 1 or 2 or 7 emails from me and Ray over the last couple of days. But this first session is what we're calling Visualize Your Career. Also, dogs are welcome. So if you all want to show your cameras and show pets are welcome, especially cute ones.
He'll be doing most of my talking for me.
Okay, perfect. And does he play guitar? That's the other question.
Of course he can.
Okay, good. Okay, well, that's close.
That's all I got. That's all.
Hey, it's a good effort. This is good effort.
Yeah, we'll give you a lot of credit on short notice to be pulling a dog out of your sack there. That's
yeah, it is impressive.
It's if anyone comes to visit my office, you'll see I have a cupboard full of inconsequential stuff. So
perfect.
My favorite thing on my cupboard is, and those who know me know I don't drink alcohol. So one student gave me a bottle of alcohol. So I don't know what to do with it. It just sits on my dresser, all right, around my counter here. So
we can use it as a decoration. Maybe put a candle in it or something.
Well, Quincy, thank you to you and Ray for putting this together. We're just delighted to be with you. What I'm going to do, and do you want me to kick this off, Quincy? Or do you
this is great. I think we've got everybody who's going to be joining us. And we do want to record this session. We're going to put all of these, just real quick to let you know, we're going to put all these on our website once the week is done. So you'll be able to access all of this. And then a couple things too, we'll keep an eye on the chat. So feel free to either unmute yourself, ask questions, show your camera, if you want to stick questions in the chat as well. But yeah, I think we can just get started. This is a Visualize Your Career. So we really want to have this be an interactive session for you all.
Wonderful. I couldn't be more thrilled to be with you. Dr. Carnuta and I are going to share this conversation. We're going to take about 50 minutes. And so what I'd like you to do is in the chat function, I'd like you to write down, type in what year you are in school. So I'm just going to take a small sampling here. So in the chat function, I'd like you to write down if you're a freshman, a sophomore, junior, senior, or any of the others. I don't think there are other options than that, are there? Okay, we've got a bunch of juniors in the house, seniors, graduate students. Oh, we've got graduate students. Good. Now, while you're typing that in, I like that. I am finally a senior. Good one, Nancy. Woohoo. I'll give you a little bit of my background, and then I'll turn it over to Dr. Carnuta to do the same. My name is Dr. Britt Barrett, and my background is I've been in hospital administration my entire professional career. I would, like you, was sitting in my undergraduate class trying to figure out what I was going to do with my life. And I was trying to figure it out. What's my calling? What do I do well? And decided to spend some time doing missionary work. I decided I'd be a volunteer. And, we've got a freshman. Yay, Leah. Okay. I decided to go to Peru. When I went to Peru with my church, the Church of Jesus Christ of Latter-day Saints, I lived there for 2 years. And I just tried to figure out what was important to me. I think this is in a time in your life where there are a lot of questions. What do I do well? What do I do not do well? What do I enjoy? What brings me, happiness? Obviously, my faith is important. My family is important. What would align with those tenets? Following that, I listened to a bunch of lectures. So when I got back to school, I went to every lecture on campus that I could possibly attend. I wanted to listen and hear from people who are in different industries. And I recall vividly engineering, education, a couple in the marketing space. In those days, social media was not real. Matter of fact, it was while I was in college that the internet actually popped up. So if you can believe life before social media. It was wonderful, as a matter of fact. And I listened to listened to a guest lecture on healthcare. And I thought to be in healthcare, you could only be a doctor or a physician, a nurse. I didn't want to touch people. I wanted to do something purposeful and meaningful and add value to the community I served in, but I didn't want to touch people. I don't like blood. I don't like any of that stuff. And he proposed the idea of a business side of healthcare. And so that's what I did. I thought, well, how about public policy? And then I saw how public policy works. And I thought, well, how about macroeconomics? And that seemed a little too sterile. So I got a degree in finance from Brigham Young, went off to medical school, did my graduate work at Washington University School of Medicine. In the healthcare space, you just need a graduate degree. You're with a lot of very highly educated people, and you need to elevate your educational qualifications. And then I went off career. For 20 years, I was a hospital president in California, San Diego, California, here in the Dallas-Fort Worth area. Most recently, the president of Medical City Dallas Hospital and Medical City Children's Hospital. And then after that, I took a job with Texas Health Resources. So I was the CEO and president of Texas Health Presbyterian Hospital of Dallas, so Presby Dallas, and the executive vice president for Texas Health Resources. Great life experience, learned a lot. Asked myself, what does God want me to do? What's my calling in life? It's to prepare the next generation of healthcare leaders. So I pursued my PhD here at UTD. That's kind of rhymes on that, PhD at UTD. And I got my doctorate here, and then was invited by Dean Percool. And if you haven't met the dean of the business school, he is awesome. He's this big, tall gentleman. Really, he's got this booming voice. And he said, Dr. Barrett, we'd like you to come and start a program at UTD. And I said, yes, sir, I will do as you asked me to do. But just really he's a faculty member. He's the dean of this school. He cares about the students profoundly. He wants us to be being mindful of your needs and wants the students to be successful. So that's my background. I joined UTD, and I have been building an undergraduate program. We created a graduate program in executive ed and also a center for healthcare leadership and management. So that's kind of my background, where I'm coming from. I've been in the healthcare field, as I mentioned before, 25 years, 20 years as a hospital president and CEO. I wrote a book that was in line with my dissertation. So my dissertation was on the convergence of strategy and leadership. And I wrote a book and do lecturing all across the United States and all across the world. That's my background. Dr. Canuta, Professor Canuti, you've got a lot of guitars in your background, so it's clear that music is a big part of your life, but I'll turn it over to you to just introduce yourself and let them learn a little bit about you.
Well, thank you for that, Dr. Barrett. Hi, guys, and thank you for coming. Just the fact that you are here right now listening to this says that you care. You've got a head start. You want to improve. You want to find out new things. So that's great. So I'll start from like my college days when I was where you were. I was in business school, and I got an accounting degree, and I wanted to be a partner at a Big 8 at the time accounting company. Now there's only 4 of them, the Big 4. But that's what I set out to do, and I knew from the beginning that in order to do that, I've got to set myself apart. I've got to at least have the minimum requirements for what I want to do. And at that time, and still I think today, to get into one of those companies, you had to be one of the top students. And so I was just focused, on doing that, on getting the grades I needed to get noticed. So I did that. I got a job with Price Waterhouse. Before there was a Price Waterhouse Coopers, there was a Price Waterhouse. And so I worked for them for about 8 years, and I wanted to be a partner in an accounting firm. That's what I started out wanting to do. So you're going to start out wanting to do something, but don't be afraid to change, because along the way, someplace I changed and said, what I really want to do, I think, is teach. I want to go teach at a university. Now, this is back when I'm really young. Okay, I'm still in my 20s. And I was going to do that. So I got accepted to Virginia Tech, and I was on my way to get a PhD. Virginia Tech, and then sort of my career got in the way. I got the opportunity to take a job with a company called Perot Systems. You may have heard of Ross Perot, maybe not. It's been a while since he's been relevant, but Ross Perot is a billionaire from Texas who started an IT company. So anyway, I went and worked for his company, and that delayed my, my PhD. But I was still going to do it, but I just delayed my entrance to the program. But then my career just sort of got in the way, So Perot Systems asked me to go and help start up their business in Europe, and this is right after my wife had our second baby. And the CFO from Europe came over and said, Dan, we'd like you to come over there and start a tax practice over there for us and help us build a company. And I'm like, I've got a 0-year-old kid, and it's just not, the timing's not right. And so he said, fine. He was good with it. And, but along the way, I was trying to look for ways to get myself noticed. So he noticed me based upon some presentation I had made, and he wanted me. So about a year later, he came back and he said, okay, your kid's about 1.5 now. You ready? And I knew at that point that was it. That was the launch pad. I either did that or went to get a PhD. And I'm like, well, I'm going to try this Europe thing out. So I went over there and was over there for a 6-month assignment that lasted 3 years. So once I got over there, they wanted me to do more stuff over there, and I couldn't get back home. They wanted me to stay over there. But eventually I did come home. And anyway, I worked for Perot Systems for about almost 20 years. We got acquired by Dell along the way, Dell Computers. So I ended up working for them and being a senior finance person with Dell. But while I was with Perot Systems is when I went into healthcare. So they've got a big healthcare unit that did the IT work for healthcare companies. And so I became the CFO of that unit. So, somewhere along the way, I went from wanting to be a partner in an accounting firm, and I just sort of got on a wave, which is what I would recommend you guys to do. If you find yourself on a wave and you're surfing and somehow or other you manage to get up on that board and the wave is underneath you and you're riding it, just keep riding it. Keep doing the best you can until you get to shore and the wave stops. So I just rode that career. I was CFO of the healthcare division for Perot Systems for many years. Then Dell acquired us, and I went with them, and I was an executive at Dell for a while. And then I was asked I got headhunted to be the CFO of Conifer Health Solutions, which is a big revenue cycle management company for the healthcare industry in Frisco. And I actually got a call from one of the old Perot Systems CFO. I wasn't even going to apply for that job. And he said, you know what, this is you. You need to do this. So anyway, I got that job. So I was CFO for Conifer for about 7 years. But all along, I never wanted to be a CFO. I just rode my career and did the best I could and was honest with people and did the best job that I could for everybody who wanted me to do something for them. And it just sort of got me there. But I always in the back of my mind wanted to come back, to teaching. So along the way, I'd gotten a master's degree and a few other things. And so I was prepared academically to teach again. And my question was just, when do I retire from the real world and go back to do what I really want to do? And then I ran into a friend of mine, Dr. Barrett. He told me what he was doing. And I said, hey, can I get a piece of that? And anyway, he helped me get to where I am today, which is where I always wanted to be all along, which is with all of you guys. So that's a long and involved story, but it's just, it says two things. As you're starting your career, you don't necessarily worry about exactly what you want to do. Have some things in mind so that you can be good at them and interview well for the positions. But once you get there, look around. Be flexible and be dependable. If you are just those two things, dependable to the people that you work for, they will then help you get to the next step. And flexible enough to do things like I did, take some chances like going to Europe for a few years. That'll help your career as well. So anyway, back over to you guys.
I love that story, and I think it puts an exclamation point on some takeaways for you. Your path is wide open. You had a good education, ride that wave, network with people on the way. So let's talk about healthcare management. Let's talk about healthcare management. I think I'm going to share my screen. Is that all right, Quince?
Yeah, that's great.
Okay.
We'll see if you can pull this off technically.
I am a
Look at that.
technical.
You're not just a pretty face.
I am so technologically advanced. I've got a question for you all. What are the challenges in healthcare? What I'd like you to do is write them down in the chat box. And Quincy, because I have the screen, I don't have the access to the chat box.
You got it.
I'd like you to read those off to us. So,
Sure thing.
what are the challenges we face in healthcare? Mind you, it's a multi-trillion-dollar industry. When I was in grad school back in the 80s, we were talking about healthcare expenses being over $800 billion. Today, it's $4 trillion, and it's estimated by 2025, it'll be $6 trillion. That growth has been exponential. So Quincy, or just jump in.
There's a couple here. We've got patient file management, several about the cost of care, quality of care, some specifics like staff retention or burnout. Somebody's been to class, the triple aim, cost, quality, and access. Optimizing bed vacancy, administration and billing costs, government regulations. Let's see, fragmentation. But let's see. So this is like, let's see. It says we learn in class all the time that one of the biggest challenges is the fragmentation, but actually experiencing how fragmented it is makes you understand how huge that challenge is. Billing cycles. So that's about it. Those are really good. You guys have attended class and taken notes.
Well, not only that, the complexity of the U.S. healthcare delivery system is enormous. I grew up in Canada. I lived in Peru for several years. I've seen healthcare in a different political climate. And the U.S. healthcare climate, let me just declare my bias here. We have the finest healthcare delivery system in the world, second to none. It's exactly how we have designed it. And any of us that have traveled internationally know that there are pockets of great care, but as a healthcare delivery system, none finer than the U.S. But there are opportunities to improve and become better and do more and be more effective. So I love the triple aim: cost, access, and quality. Why do these come into play? Is a question you might ask. Well, take a look what's happened with this pandemic. I mean, I was the first one that said, "Oh, it's cold and flu season." My kids called me from college and said, "Dad, they're talking about closing down school. They're talking about," I said, it's not going to be a big deal. Come on, we've had these. There's always the cold and flu season. This is just another variant. We had SARS. Don't worry about it. Oh, how wrong I was. It is so complex and so fast growing. Its tentacles are in virtually every sector of the economy. Never before have we seen not only the complexity, but the interchange among other industries. We've never seen that before. And so healthcare right now is a hot topic. And it's not the clinical side. It's not, we've solved some type of tremendous clinical question. It's all in the business side. Do we have enough ventilators? Do we have enough personal protective equipment? How do we distribute vaccines? How do we monitor vaccine utilization? How do we determine vulnerable populations? Should we close down businesses? Should we keep them up? How do we measure the variations? I mean, these are all business functionalities. These are not necessarily strictly clinical curing cancer. The fact that the vaccine was able to be created so quickly has made a lot of people pause. Now, let me just tell you a little bit of my bias in that. People will say to me, "Oh, that vaccine was created too quickly." To which I would respond, "Too quickly? How quick should it have been? Should have been 6 weeks? Should have been 6 years? 6 days? 6 minutes?" I mean, and people say, "Oh, well, And my response is, I think we need to be aware that the clinical breakthroughs in virology and this study of vaccines has integrated technology and ethics and process and systems like never before. So we were able to find a solution to that. I think we're opening up an amazing set of doors that will lead us to some exciting discoveries in healthcare. But returning to that original question, and someone mentioned, hey, Dr. B, what are the triple aim? Well, I think that's a fair question. And why do we use this as a tool? Because it's so big. This healthcare delivery system is so big. We've got to figure out cost, access, and quality. Now, the faculty here at UTD, as you heard from Dr. Carnuta, are well versed in not only the academic side, but also the professional side. Industry experts who understand the process and systems are here to help students navigate through complex issues. As I mentioned before, the spending is moving to $4, $5, $6 trillion. Well, where are we going with it? It's at some point going to breach 20% of the GDP, meaning 20% of the economy, meaning it's a big economic engine. And I think once we get past 21 and 22, we will see that not only is it a big part of the economy, but it influences the rest of the economy. I mean, I think retailers and manufacturing and supply chain, they're looking at what's happening in healthcare and wondering, well, what's going on there? We better understand it because it could have implications for our business side, for our retail IT technology.
So let me just jump in here real quick and ask, the questions that popped up that students submitted for this session would be, okay, it is so complex and there are so many problems to solve. How do students who are in the program decide where they should navigate? We're talking freshmen who are on the call through graduate students. Where do they begin to decide which problem should they try to tackle? Or how do they gear their career path towards something like this? What do you suggest?
I'll pitch that to Professor Carnuta. What are your thoughts, Dan? Oh, you're mute.
Yeah, well, thanks. When you guys are writing that down in the chats, you guys are hitting all the great issues that are out there, but some of them are more keyed towards how do I get a job than others. Okay, and some of them are just too broad. So access is a problem. Okay, is that a problem that resonates with you? Is that a problem that you want to try to help solve? And if the answer to that is yes, then you dig down a little deeper, say, okay, how can I do that in such a way that I can make a living doing it? And then you start saying, well, how about payer? You get into a payer organization and you help payers, HMOs, PPOs, all the stuff we're learning about. Some of you on the freshman side might not have learned too much about this yet, but trust me, you will. One of the things they have to do is build provider networks for those HMOs and PPOs to sign up doctors and hospitals to be part of that insurance company's network. Well, what does that do? Well, it gives the people who belong to that insurance policy more choices of physicians, better access to physicians that are closer, to them. So you kind of got to start small. We teach you some of the time in some of my classes, my econ class is kind of big picture stuff. But you've got to narrow that down. You've got a good understanding, narrow it down to, viable career opportunities. And, we talk about you got to take finance courses, you got to take accounting courses. I mean, right, this is a business school. Well, why? Well, think of the provider organization in the revenue cycle management space, the jobs available there. I mean, there's a lot of them, and coding, billing, the whole process, Six Sigma type process betterment, collections, everything from being in the registration department of a hospital or a physician's office, registering patients, helping them plan for value-based payment schemes that are coming down from Medicare and Medicaid, being part of the compliance department to make sure billing is accurate. So and I could go on, but the thing is, I think sometimes you get so caught up into the bigger picture, that you kind of fail to stop and think, what part of this am I interested in, and then how does that relate to, the business of healthcare and getting myself into a healthcare organization. And once you try to start to find something that of all these big picture issues, you find something that really catches you as that's something I'd want to do. Then you got to go to work. You've got to research it, find out what kind of jobs are out there. Access myself, Dr. Thurgood, Dr. Barrett. We've been out there. We can help you. Once you get to that point of here's what I would kind of like to do. What should I be looking at? And do the research. So, like I said at the beginning, you guys are already a step ahead of some of the other students because you're here. You care enough to be here and start to learn. But did you do any research before you came to this meeting? Did you get, and again, some of you freshmen aren't even at that point yet, but some of you upperclassmen, are you at the stage where, yeah, you know what, I've heard about these things in class or on the news or whatever, revenue cycle management or, payers negotiating with providers to set rates. What does that mean? And it may be something I want to get into. So do a little research on it, ask us some questions, and start preparing yourself for the next level, which is more granular than the academic level, if that helps.
Now, let me jump in here. Now we've got the president of our HMA, our Student Association, Adway's on the line, and I'm gonna turn it over to him in a second. But let me add to what Dr. Carnuta said, and I'm going to ask Adway to answer this question. How do you get into healthcare? So Adway, get ready to answer that question. I'm going to answer that question as far as I'm concerned. It is big. It is complex. And most people don't understand it. And it's been in the shadows for so long. The only reason people knew you were in healthcare is because there was a sign along the freeway that had a blue H on it, and that's about all you knew. Now people know where hospitals are and know where clinics are, and they're having conversations about personal protective equipment. It's elevating its awareness on the world scale. Understanding that is part of our role and responsibility at UTD. We're going to elevate your understanding. Introductory classes. We're going to have Dr. Carnuta's class on the finance and the accounting and the economics. We're going to have Professor Tesmer talk about the regulatory agencies and government agencies. We'll have Dr. Ayushi Mehmet talk about technology and IT. We've got Mark Moon teaching on technology. We've got all these classes that elevate your understanding so you're part of the conversation, right? Now, what Dr. Carnuta says is spot on. Elevate your understanding and then find an area of interest. There are some people that like the technology side. Wonderful. There are some people that like the people side or the marketing side or the financing side. Find out what's of interest to you. Now, Adway, I can see you're there. Do you want to share your thoughts? Adway, do you want to jump in and share your thoughts about the healthcare profession and your thoughts about how you get into it?
Sure. And can you guys hear me all right?
Yep, you're good.
Fantastic. All right. Well, I think generally speaking, and I can kind of provide, I guess, more of a tactical perspective is what I'll try to do. And hopefully this kind of answers the question. But I mean, I think, like you were saying, I think with these classes and all these various resources, you learn a lot of the kind of big picture of healthcare and kind of how the industry is. Speaking from personal experience, I would say that, getting that foot in the door, actually getting into healthcare, understanding what it's like on a day-to-day basis, what that internship will look like or that job. I think the biggest resource I have found is actually in the kind of peers who are in the classes, alongside you, or maybe someone who is a year older and, you can kind of look up to them as a little bit of a mentor. I mean, Professor Carnuta was talking about it earlier, but, everybody on this call is here for a reason. They're all interested in healthcare. And there's probably at least one other person on this call who you can reach out to afterwards. They may be doing an internship or have had a position that interests you, and you can reach out to them and talk about it, you know. And as you develop, I think, especially closer relationships with them, these are also going to be the people that kind of vouch for you and help you get that foot in the door into different companies. That's one of the biggest things I've learned is networking is not just, making connections on LinkedIn or having a person's name in your mind, but it's also building a real relationship with him where they won't just refer you, but they'll vouch for you.
See, that's why I'm glad, and thank you, Edwin. He's the president of the HMA. And Edwin, what year are you in school now?
I am currently a junior.
So he's in that phase of learning and becoming more. I just really advocate, if you're interested in healthcare, join the HMA association. This is the Healthcare Management Association. Edwin, I'm going to invite you or one of your officers to put information in this chat function on the side on how to get there, how to participate, how to be part of this great effort. Okay, but let's move on if we can. I began with cost, access, and quality, right? And I said, well, take a look at the healthcare dollars. Take a look at how they're growing as a percent of the GDP. That number continues to grow at an astounding rate. So it's going to be a big part of our economy. But we don't have a lot of smart business functionality. Let me give you a quick example. When I say business, I mean technology, finance, economics. I remember something as simple as telemedicine. Prior to the pandemic, most physicians refused to use the power of technology to reach out to their patients. Today, 80% of physicians have used telemedicine for the first time. Can you believe that? In this day and age, something as simple as FaceTime or Zoom or Teams was never used in the healthcare space. They're finding 70 to 80% of their patients love the idea. Well, that opens up a lot of doors for creativity into the future. That's but one example. Let me give you a second example. I had a student I was teaching, and she said, I'm sick and tired of having to wait in a doctor's waiting room. I wish if he or she was going to be late, they let me know. So she started a company. She built it. Her idea was, why don't we just use the technology from Chili's, right? And you carry a beeper, or you use a cell phone to text patients if the doctor's going to be 2 hours late. Wouldn't that be fantastic? Well, you say to yourself, well, yeah, that seems pretty straightforward. If I ever have to call and have a technical issue, they'll say on the phone, hey, we've got a long backup, and if you'd like us to call you back, put in your number here. I think some of you have seen that. We never use it in healthcare at all. But what would happen if we did? Now, this Shelby's started a company, and soon she's going to be bought out, and it's going to be a multi-million-dollar company that she started because she looked at the healthcare expenses, compared them to international numbers, looked at our premiums for coverage, cresting at $20,000. We look at the national healthcare dollars and we say, we need to be mindful and understand the healthcare business side, and we need to be responsive to cost, access, and quality. So what kind of creative ideas can we come up with? The value of the healthcare management degree, let me go back to, the value of the healthcare management degree is you're surrounding yourself by talent, the Adways of the world, and the Nancys of the world, and the Quincy's of the world, and the Carnutas of the world, on what are the challenges of healthcare. And with that in mind, we can come up with seemingly small answers to big issues. Now, I'm going to pause there for a moment. Professor Carnuta, is there anything you'd like to add to that conversation before we transition? Yep, you're on mute.
No, the takeaway, I think the takeaway there is that you guys have picked a good field to be in at this particular time. And The economy as a whole is looking for talent to join businesses. So that's good. And you're in a particular industry that's very hot right now in the healthcare space because of all the change that's going on. So, I guess the landscape is really couldn't be better, for you guys. It's just a matter of now you focusing on how you can best fit into that landscape.
Perfect. Let's go back to, let me go back to my slides. Can I go to my slides, Quince?
You should be able to. I think it's just a share function.
It just doesn't like me. I'm trying.
Well, while you're looking at that, just some things to kind of think about. Some other questions that the students submitted for this specific session are, in addition to the content that they learn in classes, what are skill sets, characteristics, things that you, if you were the interviewer or if you were the hiring person, what are things that you're looking for in students as they are, becoming maybe an entry level or an early careers type of position? What is it, some advice that you can give our students about and how they can best prepare themselves now while they're in the programs?
I think that's a great question. I think understanding the implications of cost, access, and quality are imperative. So that's a first step. And then recognize that we have been following a medical model, just basically absence of illness or disease. That's how we've been navigating through the U.S. healthcare delivery system. The World Health Organization has a much more holistic view that it talks about your physical, mental, and social well-being, not just the absence of disease. You're going to see more and more of that. So individuals need to understand what are the determinants of health, the environment, your behavior, lifestyle, heredity, medical care. All of these things are converging. So understand the basics of healthcare and then to start exploring a more holistic view. Our U.S. healthcare delivery system has characteristics that make it unique. There is no centralized agency, but we are driven by new technology. We have unequal access issues and imperfect market conditions. Take a look at what happened with the pandemic. All of a sudden, the hospitals in New York went ballistic. They were full. They were at full when the pandemic came out. But here in Dallas, we never saw that. What would happen if we saw the same type of dynamics in Dallas as we saw in New York? Would people die? So explore, be curious. Ask the question, is healthcare a right or a privilege? Is market justice versus social justice? Be curious. Recognize that we're talking about a small portion of the population. Only 5% of the population drive 50% of all healthcare spending. 3% of the population don't have any healthcare spending at all. You see that far right-hand side? So it's go where sick people are and start asking the question, how do we improve their health? The United States has unbelievable technology, training, institutions, but all sorts of duplication, complexity, and inefficiency. Because we're so technologically driven, we see new equipment emerge, but there's time and time again this demand for the newest and the most sophisticated. I'm going to leave that with this last slide. In the midst of all this emerging technology, government is playing a much more prominent and more significant and more purposeful and intentional role. This is but one slide of the healthcare system and all the public agencies that come into play. So I'm going to pause there a moment and return to the question that Quincy asked. What kind of skills do you need to navigate this healthcare terrain? Well, Dr. Carnuta mentioned them. I'm gonna give my top three, then I'll invite Dr. Carnuta to do the same. But Oh, and I love Rita's point, leadership. Yes, Rita, leadership, leadership, leadership. I think you need hardworking individuals who are creative and that they are purpose driven. I think those are three areas where I think leaders of the future will emerge. Professor Carnuta, what do you think? What skills do you think a healthcare professional will need?
Yeah. So when you're looking for that job, first, like I said before, you've got to figure out what exactly you want to try to get into, find that job, and then you land the interview, right? What's the next step? Well, you've got to be prepared. Okay. You have to work before you get into that interview room. You've got to research. You've got to research the company. You've got to research the people in the company, the top people, anybody you can find, on LinkedIn or whatever. Find out about them. What's going on in the company? What are their big issues? You're going to want to come with questions, about the company to the interviewer, stuff that they probably don't even know about the company. You have to be better prepared than the person that's interviewing you to know about that company. Okay. You got to do something that's going to set you apart. If you just walk into that interview dressed real nice and sit there and expect them to just ask you questions and you give them yes or no answers, you're not getting the job. Because there's 3 or 4 other people that they're looking at the same day right behind you or in front of you that are sitting in that interview room. So you got to do something to separate yourself. So you've got a great education. Again, do some simple research on the company and on the position that you're applying for. What are some of the issues with that position? What's involved in it? Then you can ask the questions, those same type of questions to the person that's interviewing you. But you've got to be prepared, better prepared than the next person. And if you can then also, so you got to know about the company, know about the position, make sure that the interviewer knows that and they're going to be way impressed if you've done some outside research on their company. And then, as you're going through your, the last parts, as you become an upperclassman, I always recommend to students that they gain some analytical skill.
Yeah.
Whether it's a minor in something like, finance, accounting, IT, something like that, that's going to separate you from the next person rather than just a general business degree. I mean, that's not to say that you can't land the job with a general business degree, because you certainly can. But if you've got some analytical skills, and even if you don't have the minor, if you have a certificate, or if you're just a dang good programmer, because it's something you fiddle around with, in your spare time, don't be afraid to make sure and brag about that analytical skill to the interviewer, because that's what they're looking for too. Because whatever you're going to be doing, you're going to need some analytical skills, Excel spreadsheets, and that type of stuff. So that's my 2 cents on getting that job.
I have a follow-up question too. We have several graduate students who are on the call, and so they might either be looking for a career move because they're getting this degree, or maybe they are just looking for maybe some advancement within their own company. But what advice do you have for graduate students as they are also trying to navigate where do they go from here, and how do they best position themselves for either entry level or maybe just for a promotional purpose in careers in healthcare? What's some graduate student advice you'd have?
Here, let me answer to that question in my experience. I realized that I needed to know as much as I possibly could about the industry. You just have to learn. It is so big and so complex. So back in the day, I subscribed to a number of magazines that wrote on this topic. And then I would go to events and activities to listen to what healthcare professionals had to say. I think with the advent of the technology, you can get on Becker's Review, Modern Healthcare. You can get in KFF.org, which is the Kaiser Foundation, Dallas Healthcare Wildcatters. Those are resources and locations. Understand the industry. Understand what's going on. Ask curious questions. Associate with those. That's why I love the HMA and why I'm a big advocate of project work on this classwork, is get to know your colleagues, your friends, on what they're doing in healthcare. So that's the number one. Number two, find a purpose and meaning behind why you would get into healthcare. We talk about cost, access, and quality. Well, if cost is a big issue, what are you going to do about it? What role will you play? What things must you do? What skills must you develop? I realized that I was not necessarily a technology person, but I was a business person. So I got a degree in finance. There was no health management degree back in those days, but I got a degree in finance so that I could understand how the numbers worked. Dr. Kernuda talked about that. You know, what's your purpose in life? Why do you do what you do? What's of interest to you? Understanding yourself is that big step. And then the third is rub elbows with amazing men and women. My office is in 2.411. Dr. Thurgood's office is next door. 2 doors down is Dr. Carnuda's. Just around the corner is Quincy's. We're here and we're around. Now, our doors are usually closed, so knock quietly. And if we're not in a meeting or in a call, we'll poke our heads out and invite you in to visit. We do have office hours that are posted on our doors. Start asking the question. I get calls all the time, Quincy. I get calls all the time while I'm driving to and from work, students saying, hey, what do you think? And popping into my office and saying, I'm asking. Well, I think those kind of behaviors prepare you for a degree. If I was going to say what the future holds, I think the utilization of smart business practices and the delivery of healthcare is where the
Perfect. And I think some of that advice, I had posed a question for graduate students, but those things that you just mentioned would certainly be applicable to undergraduates as well. You know, joining HMA is the first step of, you know, getting to know people and networking, learning how to do some of that naturally. Something else that we always recommend is volunteering. So you get to know people just by being a volunteer, either on campus, you get to know professionals, you get to know faculty. When we bring in guest speakers or we do events, just through volunteering, you just get to know who's who at the zoo. So a great way, also out in industry, of course, to volunteer there. But I just think getting to know people in the industry and what they do really helps open your eyes to what the possibilities might be.
Yeah. So if you're at a company and you're looking, how do I get to the next level? The first thing you should be thinking of is, what can I do that the person whose job I want is doing? And take that role. Take some of that stuff off that person's plate so you can start showing that you can do the role. Now, it takes a little bit more work. Okay. Because you got your own job and then you're helping them with something. Well, that's what you've got to do. You've got to be a go-getter to go and get those positions. So that's what I always tried to do when I was with the accounting firm, is I need to be doing some of the stuff that the guy, at the next level is doing, so that they can think of me as a next level person as well. And then also market yourself in the company. Make sure people know who you are, especially the decision makers in the company. Who's deciding on these promotions? Make sure they know who you are and what you've done, not in a braggart kind of a way, but just, and let them understand you kind of brand and market yourself to get to that next role. And if your goal is to get a job outside the company, you're looking to leave your company and get another role in some other company, then again, you just got to do the research, of what's out there and what does my resume need to say in order for me to get that position. And then go get whatever if you're lacking something on your resume, go get it. Okay, so none of this stuff is ever going to come to you. And that's, well, I'll take that back a little bit. Some of it, if you're dependable and some will come to you, and hopefully you'll have to make a decision whether or not you want to, go a different path than you're currently on, because someone's inviting you, to that other path, and that might be a path that's better than the one you're on. So if you work hard, and like I said, you're dependable and flexible, those opportunities will come, and you just got to grab them when they do.
You got to be in motion. It sounds hard, doesn't it? It sounds like, well, there's no real answer. Well, it's because it's hard, and there are all sorts of possibilities, but you got to be in motion. And we're here to help you. We're here to point you. Quincy, I love that idea about volunteering. It's one of the things I did early in my career. I volunteered for everything just to get experience in healthcare. I was a Special Olympics hugger. I don't know if you know that Special Olympics has but then I was a host for a group of family at a condominium. And then I pivoted from there, and I was the put together a charge master for a clinic. And then I did all this volunteer work in different areas, volunteer at a hospital. I just tried to get into the field to see what was attractive to me. When it came time for me to interview for jobs, then I could point to those experiences and go, see, I've been very involved in healthcare for decades. I've done X, Y, and Z. So I encourage you to do that.
Well, that was going to be my next question, or maybe even my final question, depending on how much time we have. But what is maybe a few things, 1, 2, 3 things that students can leave with today, a recommendation that they should go and do? Let's just say setting a goal by Saturday or by the end of the month, or maybe by the end of the semester. But what are some very tangible, relevant, practical tips or advice, things that students should leave here to go do?
Let's do a speed round. I'll say one, and then Professor Carnuta, you say one, then Quincy, you get one, and then I'll say one. So what do you need to do next? Number one, you need to join a student association. Boom. You gotta get involved with other students and participate. So join HMA. Dan, speed round, what do you got?
I would say it differs. This is going to differ by person and what level you are in university, freshman, sophomore, junior, etc. But to take a step back, and reassess, what you've learned and where you want to be 5 years from now.
Put together 5 years.
Then start plotting out your path to get there.
Quincy, speed round.
Speed round, attend every session possible this week. There are 12 sessions between now and Friday. Boom.
Boom. Another one, podcast. Listen to podcasts. You want to hear a good one that'll freak you out? Listen to Dr. Death. You want to get freaked out? And it's not just the clinical, it's how did we allow a physician to practice medicine when he's a killer? And he's in jail right now, so he is indicted and convicted, so I can't call him a killer. Okay, Dan, speed round. What do you got?
Read the Wall Street Journal every day, and grab one periodical, a magazine type of thing, whatever. It's probably online now, for the industry, whether it's HMA or ACHE or one of those organizations, and read it religiously. Because you will be surprised how smart you get in a very short period of time just by reading things like that. You pick up everything that's going on, and all of a sudden, you're well read.
Speed round. Quincy, what's your next one?
Okay, next one. I want you to go to one of the big names in town: Baylor Scott and White, Texas Health Resources, Medical City, HCA. Find an employer website. Go to their job posting site. It's maybe under HR. Find a job that's under staff. Find a job description of something that seems interesting to you. Good. Then work backwards to see what do they require: education, experience, and try to make a plan. As Dr. Carnuta said, make a plan for yourself. But go to one of those big websites, find one job that seems interesting, and try to make a plan for yourself. Just do it as a practice round this week.
Speed round. Go out to lunch with some friends and ask them the question, how do we reduce costs without decreasing quality? Here's my follow-up that at Thanksgiving, ask your parents, is healthcare a right or is it a privilege? And then let the place blow up. Go. What's next?
All right. I want you guys to relax. Okay. Take a deep breath. This all sounds really hard, and it's all just a big black hole in your future that you're afraid of. But once you get this thing started, once you get on your way and you take the first couple steps that we've been talking about, it will gain momentum and it will go downhill, not uphill. And all of a sudden, it'll be 10 years from now, and you'll be looking back and you'll be saying, how did I get here?
I love that.
So just relax, take those first steps.
Quincy,
we should end with that. I think we should end with that. That's a perfect ending.
I love that. We're here to help you. We're here to support you. We're preparing the next generation of healthcare leaders. I know your faculty, have sacrificed a lot to be in the classroom. It's certainly not the luxurious salaries or luxurious lifestyle. Heck, it's not even the parking around here that draws us towards you. It's you. And we're here to prepare you and help you. I'm in JSON 2.411, second floor, room 411. Dr. Carnoon, what's your room number? What's your office number?
They're too complicated for me to remember. So I'm 2 doors. I'm 2 doors down to the left from Dr. Barrett. I think it's 46216. I don't know. I give up.
16. Dr. Thurgood's next door. Come visit us. We would be delighted to visit with you. Are there any last questions that anyone has? We've been watching the chat function. Okay. Well, it's almost 1 and I've got to go teach a class.
All right, everybody. Okay. Bye-bye. Thanks for joining.